Hello, my name is Ian McCall. I was one of the organizers for the Skin Cancer College weekend meeting called Getting Under the Skin, Dermatoscopy Meets Dermatopathology. If you're involved in skin cancer medicine, then many of the lectures presented here are going to be of great relevance to you. And what I want to do is just to give you a quick overview of what the lectures would contain so that you can decide whether to buy the full set of these lectures, which I'd recommend, or just individual ones. We were very lucky in getting, as a visiting speaker, Clay Cottrell. Clay is an eminent dermatopathologist from the USA, from Dallas, and he contributed tremendously. This workshop was organized to be interactive. Many of the lectures, in fact, have two speakers. There will be a college member who will present the clinical and the dermatoscopy of topics, and then Clay would go over the histopathology. And this interactivity worked very, very well. But let me just go through the talks. The first one was one I did myself, and it was in relating the pathology report to the dermatoscopy report. I basically went through the important topics in dermatopathology relating to tumors, just going through some of the basic terminology, the words that are used in pathology, and I did the same thing in dermatoscopy for pathologists who were there. It runs for about half an hour. It's at a fairly simple level, and it's a useful introduction to the course. The second lecture was in fact done by Clay. Unfortunately, I introduced most of them, so my picture gets in the front there. Clay looked at skin biopsies and the way in which they're done, the importance of doing them in particular ways. He looked at different stains that are used. He went through the whole gamut of the importance of the skin biopsy in dermatopathology, certainly in skin cancer dermatopathology. It's a good lecture. It's a great, gives you a great understanding of why you should biopsy certain lesions in certain ways, why a pathologist needs a whole pigmented lesion, if at all possible, to analyze it properly, not a punch biopsy. So this lecture lasts about an hour, and I totally recommend it. The next one is a joint lecture by Clay Cockrell and Cliff Rosendahl. Now, Cliff was a co-organizer with me of this course, and he's a world expert in dermatoscopy. He and Harold Kittler and some of the colleagues have written a book on dermatoscopy, which I'd certainly recommend. What happened here was Cliff presented the clinical features, and Clay again went over the histopathology. They go through all melanocytic lesions, starting from simple lentigos, lentigo simplex, solar lentigos, all the way through to the various types of melanoma. So if you want an understanding of a correlation of dermatoscopy and dermatopathology of melanocytic lesions, this would be the lecture for you. I think, again, it lasts about an hour. The next lecture is a very short one. I think it's a freebie in this course. It was on melanocytes. One of the attendees indicated that, you know, what is a melanocyte? They seem to look very different. And so I just spent 5 minutes putting together a short PowerPoint lecture on the various phases of melanocytes in different conditions. Then I did a lecture with Clay. We were looking at some non-melanoma skin cancers. We concentrated a lot on basal cell carcinoma, and we related the histopathology to the management, to the clinical features of the lesion and how they should be cut out, margins that should be put on them, even how they should be biopsied. We spent a long time on the various types of BCCs because that's the commonest tumor that you're going to see in skin cancer practice. And we also did a bit on SCCs as well, and looked at the whole question of how do you describe SCCs as well differentiated, moderately differentiated, poorly differentiated, what's the clinical significance of this, how good are pathologists at how reproducible are pathologists in giving these levels of differentiation of SCCs. Again, lasts about an hour. We had to curtail it a little bit because we wanted to do some of the gems. The next lecture that is here again is a superb lecture. It encompasses virtually all the benign lesions. It was done by Jeff Keir, doing all the clinical and dermatoscopy, and Jeff's an expert in those areas, and Clay looking at the histopathology of these. So all the various benign lesions that you may have come across in your work, if you want to look at the correlations between the dermatoscopy and the dermatopathology, this would be the lecture for you. Again, it's about an hour. We ended up day one with Cliff Rosendahl looking at this dermatoscopic histologic correlation of pigmented lesions. Again, to be able to look at a dermatoscopic image and work out from that what the histology is going to look like is very useful. Because when you get a histo report back, if it doesn't mention the various things that you would have expected to see, you wonder if the pathologist has actually sectioned it and sampled representative areas of that lesion. So if you like looking at histopath slides and even just looking at a histopath report, and you want to correlate it back to what you were seeing through the dermatoscope, you'll find this lecture by Cliff very useful. I think it runs about 45 minutes. We also had gems on day one, but I'll come to those shortly. The gems were short presentations by members of the college. Day two began with Clay giving an excellent hour-long lecture on reconsideration and reconciliation, the diagnosis and treatment of pigmented skin lesions. He looked at all of the various recommendations from the American Academy of Dermatology on the treatment and management of melanoma. And I think you'll find it very interesting. He really takes these recommendations apart and indicated the political nature in which they were in fact put together. He looks at the evidence for the various recommendations and debunks a lot of it. So if you'd like to see and listen to quite a controversial lecture on pigmented skin lesions, then I'd recommend this one to you. It looks at sentinel lymph nodes, it looks at mitoses and the assessment of them, how important they are, and all these recent changes that there's been to the way in which melanoma management is recommended, both here in Australia and in the USA. I think you'll find this a good lecture. It lasts about an hour. Then I did a lecture with Rob Panisi, a pathologist here on the Gold Coast, looking at some other important tumours in skin cancer practice. We didn't get time to get through everything we wanted to cover, but we looked primarily at Merkel cell, atypical fibrous xanthoma, some of the spindle cell tumours, the T cell and B cell lymphomas, and a few others of the more unusual lesions that you might see. I think this one just lasts about 45 minutes. Then comes the gems. The gems were a series of short 5 to 10 minute presentations by various college members. And they were very interesting because we had Clay able to look at the histopathology and add his insights into the images that were in fact presented. I'm not going to go through all of them here with you. I'll just mention a few as we go along. John Pine looked at cutaneous horns, a survey that he had done of, I think, about 150 of these, looking at the features of those that ended up benign, having a benign base, and those that ended up having an SCC at the base. And it was quite fascinating. There was an excellent Merkel cell talk by Graham Siggs. This one lasts about 15 minutes, and it'll have everything in there that you've ever wanted to know about Merkel cell. There were some others that were presented. Neil Chorley looked at a poorly differentiated SCC and just the management of that. But there were some good little vignettes on clear cell acanthoma, on a nevoid melanoma, which is always a difficult one. This was interesting. Clay wondered about the diagnosis here as to whether, in fact, this was a nevus spiralus with a melanoma developing within it rather than the whole thing being melanoma. but it was really a good talk. This was one of the virtues of this meeting. These little gems that were presented, and the opportunity to discuss them with a world-renowned pathologist and get his take and interpretation on them as well. I think it brought out to us the importance of dermatopathology and the fact that there can be a disparity sometimes in the way different pathologists see things. And that was an important thing that was brought across to us in this meeting. So these are the gems. Most of the gems, as I say, are 5 to 10 minutes, and I'd thoroughly recommend this section to you as well. Well worth looking at. There was one on dysplastic nevus of the face of the elderly, a diagnosis we don't like making. Very few elderly ever develop dysplastic nevi. The second day finished with a couple of excellent lectures. First, there was one with both Cliff Rosendahl and Clay Cockrell looking at difficult melanocytic lesions. These were ones that Cliff has collected over a considerable period of time. Some of them, many of them were his own. Some came from the Skin Cancer College's blog. And again, if you see difficult melanocytic lesions and you want to see two experts in their field discussing them, then I'd thoroughly recommend this talk too. And the meeting ended with Jeff Keir doing a variety of gems that he had presented himself. There are about 6 there. And in many ways, these were a beautiful finale to this course because they covered many of the things that we had looked at during the weekend lectures. And Jeff's a great presenter. There's about 6 excellent gems in there, with Clay Cockrell also commenting on the histopathology. So I think it goes for about half an hour or so, and I'd thoroughly recommend this lecture as well. I think you've heard me thoroughly recommend everything, but it really was an excellent weekend. It's the first time that the Skin Cancer College has organized a purely dermatopathology meeting for skin cancer doctors, and it really was a great success. We had marvelous feedback. They found the lectures clinically useful. They found them quite stimulating, and we're keen to run a similar lecture series again next year. So I'd advise you to buy the whole series here if you haven't, if you weren't at the meeting, and if not, then look at the area that you want more information on, particularly if it's melanocytic lesions. Then this lecture by Clay and Cliff will certainly give you a marvelous introduction to the topic, and I hope stimulate your interest to explore it further. Thank you very much.